The air in the nursing home was thick with the scent of lavender and disinfectant, a perpetual reminder of life's fragility. It was here, amidst the gentle hum of medical equipment and the soft murmur of conversations, that Oscar, a ginger cat with eyes like melted gold, found his calling. Oscar wasn't your typical nursing home cat. He didn't seek out laps for warmth or swat at dangling yarn. He preferred to roam the halls, his lithe body a shadow flitting through the sterile corridors. Yet, there were times when he'd exhibit a rare tenderness, his usual aloof demeanor dissolving into a gentle purr. Dr. David Dosa, a young physician, had been working at the home for a few months when he noticed a peculiar pattern. Oscar, the seemingly indifferent cat, would often gravitate towards certain patients, his eyes fixed on them with an almost mournful intensity. He would settle beside them, sometimes nuzzling their hands, as if offering comfort. At first, it was a curious coincidence. But as days turned into weeks, the correlation became undeniable. Every time Oscar lingered near a patient, that patient would pass away within a few hours. The staff, initially bewildered, soon began to whisper about the death cat, a superstition tinged with awe. Dr. Dosa, however, was a man of science. He couldn't dismiss the phenomenon as mere coincidence. He observed Oscar with meticulous care, noting the cat's behavior and the patient's conditions. He searched for any medical explanation, any sign of illness or injury that could account for Oscar's uncanny ability. One day, he found himself in the room of a frail old woman, her breaths shallow and her eyes glazed over. Oscar was nestled at her feet, purring softly. Dr. Dosa sat by the bedside, his heart heavy with the knowledge of the woman's imminent passing. He wondered if Oscar was sensing the woman's deteriorating health, or was it something else entirely? As the woman breathed her last, Oscar rose from his perch and walked over to Dr. Dosa, his golden eyes locked onto the doctor's. There was a strange wisdom in their gaze, a glimpse into something beyond human comprehension. Dr. Dosa, deeply moved, felt a surge of sadness, not for the patient but for the cat. He knew he couldn't explain it, couldn't quantify it. He could only acknowledge the truth. Oscar, the stray-turned sentinel, possessed a gift, a haunting premonition that he used to offer solace in the face of life's inevitable end. News of Oscar's ability spread, attracting attention from the media and the scientific community. Dr. Dosa became the cat's unlikely spokesperson, his voice echoing the question that haunted everyone: how did Oscar know? The answer, it seemed, lay not in science but in the mysteries of the animal kingdom. Was it a sixth sense? A heightened sensitivity to changes in the body? Or something more profound, a connection to the unseen forces of life and death? Dr. Dosa, like everyone else, was left to ponder the enigma of Oscar's gift. The cat, meanwhile, continued his silent vigil, a furry sentinel in a world grappling with life's fragile beauty and inevitable end.